My name is Zach Elkin, and I'm the Director of Auxiliary Programs at SAA and the school's Pandemic Safety Coordinator.
And I'm Diana Gordon. I'm SAA's school nurse.
We hope that everyone has had a great start to the school year, and we are super excited to welcome many students into the building soon. The purpose of this video is to orient families to our new health and safety protocols and how we will work together to keep our community healthy.
We shared a lot of information already in the health and safety guide that families received before the start of the school year, but now we want to take some time to walk you through what you can expect at school. There is lots of important information in this video from start to finish, so we hope that you'll watch the video in its entirety and that you'll reach out to us if you have any questions.
Let's start with SAA's multi-layered approach to reduce risk of COVID-19 transmission, which highlights the school's primary risk mitigation plans. While each of the health and safety measures we will discuss today are important on their own, by combining them, we create a layered set of protections against COVID-19. While we must remember that there is no such thing as zero risk, if we can all work together and commit to these shared responsibilities, SAA will continue to be a healthy and safe place to go to school. In this video, you'll see how many of these layers will be put into practice this school year. So let's jump right in.
All students, teachers, and administrators must monitor their health to make sure they're healthy enough to enter the building. Every day before leaving home, a parent or guardian will complete the daily health screener for each SAA student. This includes recording the child's temperature and answering a brief set of health questions. Based upon the answers, a student will either be cleared to come to school or wait for a phone call from SAA to discuss if your child will be able to attend school in person that day. Every family must download SAA's Health Screener app and create an account before their child's first day of in-person learning.
There are several important changes to school drop-off this year. First, to start the year, drop-off will occur in the front lot only, accessed off Minor Street. The back lot will be used exclusively for faculty and staff parking and is not available to families at this time. In addition, the playground will not be accessible before and after school. At this time, we are discouraging carpooling, but realize some families will not have other options. We ask that all carpooling students practice good personal hygiene and wear face masks during the commute. For drop-off, cars will pull up alongside the front of the building and will be greeted by an administrator. Adults should stay in their car unless needing to assist younger children. From your window, an administrator will scan the QR code from the screener app on your phone or tablet. Next, students, with their belongings and face mask on, will stand beside the car and have their temperature taken before the car drives away. Especially during the opening weeks of in-person learning, additional staff will be on hand to provide support for students as they enter the building, including reminders about sanitizing hands and where to go for their first period class. As a reminder, at this time, parents and guardians are not permitted in the building.
Face masks are required for all students, teachers, and administrators while at school. Every student must wear a clean mask to school each day and have 2 clean masks available as backups. The inside of the mask must be labeled with the child's full name, which will also help distinguish between the inner and outer layer of the mask when taking them on and off. It's really important to pay attention to the do's and don'ts of choosing a mask, wearing a mask, and cleaning a mask. We encourage all families to check out the resources available on the CDC website. During the day, students will have a chance to remove their masks during lunchtime, safely hanging them from a hook on their desk. SAA will continue to evaluate the safety of removing masks in select situations when outdoors. Overall, children have been shown to do really well with extended periods of mask wearing. And because masks are an important and proven safety precaution, it's our goal to have students wear them at school as much as possible.
If I know anything about our SAA community, it's that we can stay connected even while we are apart. We've shown this in virtual learning, and we can continue to keep our strong connections in the building too. Keeping a safe distance of 6 feet is an important measure we can take to avoid spreading germs to one another. While you're at school, you'll see several different ways we've implemented physical distancing. First, Students will be in grade level cohorts, meaning they won't mix with students in other grade levels, thereby limiting their number of exposures. Classroom desks will be spaced 6 feet apart. Students will walk in physically distanced lines when going from one classroom to the next. Shared areas like lockers that are prone to students congregating in will be closed off, and greeting each other with air high fives and air hugs will be the new normal. We know that it will be impossible to stay 6 feet apart from each other all of the time, but if we try our best to keep this safe distance as much as possible, we're all doing our part to keep each other healthy.
We hope that everyone has been creating their own personal hygiene routines at home. Simple actions like washing hands and using the inside of your elbow to catch a cough or sneeze are incredibly effective at preventing the spread of germs. At school, students will learn when and how to perform hand hygiene throughout the day, paying particular attention to before and after transitions like entering and exiting a classroom, before and after eating, using the restroom, before putting on a mask and taking it off, and after sneezing, coughing, or blowing their nose. We'll take full advantage of all the touchless sinks in our classrooms and our new touchless portable hand washing stations. This will allow for more frequent hand washing without the unnecessary crowding of restrooms. Students will leave SAA every day with their hands the cleanest they've ever been.
In order to keep everyone healthy this year, we will pay special attention to the way we use restrooms. This year, teachers will schedule restroom breaks with their classes to monitor the number of students in the restroom at any one time, which as of now will be 2 students at once. Signage in the restroom serves as important reminders about proper hand washing technique, and the new touchless toilets, sinks, soap and paper towel dispensers, plus the installation of dividers between sinks, will help prevent the spread of germs. Of course, students will always be allowed to use the restroom outside of their scheduled times, but these designated breaks will prevent overcrowding and mixing of cohorts in the restroom areas. Additionally, restrooms will be a priority for our custodial staff, who will perform regular disinfection throughout the day.
We've already demonstrated the many ways we're keeping SAA healthy, but what happens if your student does become ill during the day? We are now equipped with a fully functional health services center staffed by a full-time nurse to address all types of students' needs while at school. If a student isn't feeling well during the day, their teacher will contact health services before sending a student for care. This will prevent potentially infectious students from accidental contact with healthy ones. Within health services, there are 2 isolation rooms where sick individuals will be triaged and assessed. A sick student needing to go home will wait in the isolation room until their parent or guardian picks them up. It's more important than ever that sick students are picked up as soon as possible and within 1 hour of the parent or guardian being contacted. Of course, health services will always be available to address the everyday needs of students too, such as managing medical conditions, administering medications, and treating injuries.
Like school drop-off, pickup at the end of the day will be limited to the front lot only, accessed off Minor Street. The back lot will be used exclusively for faculty and staff parking and is not available to families at this time. Just as in the morning, the playground will not be accessible after school hours. Cars will pull up alongside the front of the building and must clearly display their yellow car line number placard on the front windshield. Families received their placard in their virtual learning kit, and as a reminder, returning families are assigned the same number as last year. As in the morning, we ask that adults stay in their car unless they need to assist younger children into their car seat. An administrator will call out students by their number via walkie-talkies. Students will sanitize their hands upon exiting the building and will come outside to wait physically distanced near the front doors until their ride pulls up to the front of the car line. As a reminder, pickup is only being done by this car line process. At this time, parents and guardians are not permitted in the building to meet their students. Thank you for watching this health and safety orientation. We hope it was helpful. At the start of place-based learning and throughout the year, students will get a chance to practice all of these new routines, and with time and patience, eventually they will become second nature. Parents and guardians, if you haven't done so already, please familiarize yourself with the health and safety guide that will be continuously updated throughout the school year.
We understand that this orientation didn't cover every aspect of how school will look different, so we intend to continue sharing more information and training as the year goes on. In the meantime, please feel free to reach out to us with any questions. We look forward to seeing many of you at SAA soon.